part 1 of this video, we will demonstrate the technique for collection of oropharyngeal (OP) and nasopharyngeal (NP) swabs. There are 3 important points to highlight prior to demonstration of these techniques. First, when possible, specimens should be collected within 3 days of symptom onset from patients meeting the case definition. Second, only sterile Dacron or rayon swabs with plastic shafts or flocked swabs should be used. Do not use calcium alginate swabs or swabs with wooden sticks, as they may contain substances that inactivate some viruses and inhibit some molecular assays. Finally, check to ensure that you have all the appropriate supplies and arrange them prior to starting the sample collection process. Here is a list of the materials needed. Nasopharyngeal swab, oropharyngeal swab, goggles, gloves, surgical mask, viral transport media vial, marker, scissors, tissues, tongue depressor, biosafety bag, soap and water or alcohol-based gel. Step 1. Wash hands thoroughly with soap and water or an alcohol-based hand gel. Step 2. It is important to always wear appropriate personal protective equipment, PPE, when collecting clinical specimens. In this case, this would include the use of goggles for eye protection, a surgical mask, and gloves. Put on the mask, goggles, and gloves. Step 3. Remove the viral transport media, VTM, vial from the packaging and label it with the date, patient identifiers, and any other required information. Step 4. Ask the patient to blow his nose and dispose of the tissue in the biosafety bag. Step 5. Position the patient in a comfortable position, if possible, with his head against a wall to ensure that he does not move during the sample collection process. Step 6. Remove the OP swab from the packaging and insert it into the posterior pharynx and tonsillar areas. Rub swab over both tonsillar pillars and posterior oropharynx and avoid touching the tongue, teeth, and gums. Step 7. Place the swab immediately into a sterile vial containing 2 milliliters of VTM without antibiotics. Step 8. Aseptically cut or break applicator sticks off near the tip to permit tightening of the cap. Step 9. Remove the NP swab from the packaging and insert the swab through the nares parallel to the palate, not upwards, until resistance is encountered or the distance is equivalent to that from the ear to the nostril of the patient, indicating contact with the nasopharynx. Gently rub and roll the swab. Leave the swab in place for several seconds to absorb secretions before removing. Note that tearing is a normal response to the insertion of the NP swab. Step 10. Place the swab immediately into a sterile vial containing 2 milliliters of VTM without antibiotics. Samples can be placed in the same vial if desired. Step 11. Aseptically cut or break applicator sticks off near the tip to permit tightening of the cap. The process of collecting the NP sample will be demonstrated using the sagittal model of a human head. Note that the NP swab is inserted until contact with the nasopharynx is reached. Step 12. When collection is complete, dispose of all PPE and other contaminated materials in the biosafety bag. Step 13. Wash hands thoroughly with soap and water or an alcohol-based hand gel.